Well, most people are aware that snoring can be a sign of sleep apnea, but there are a lot of people who snore all the time and they don't have sleep apnea. Well, thankfully for these people, there's a simple cure.
Yeah, here to tell us more about the solution is Dr. Madan Kandula. He is a board-certified ear, nose, and throat specialist with Advent, and Advent stands for Advanced Ear, Nose, and Throat Specialist. Nice to have you back.
Nice to be here.
Thank
you. Thank you.
We talk about snoring a lot on our show.
Because Molly snores. No.
That's right.
But the pictures we had were perfect. I think there's so many people out there, they're like, that's me.
Yep.
In fact, our guest just before was saying, we've solved the snoring problem in our house. I sleep in the guest bed.
That's a lot of people, more than you think. Yeah.
Well, we talk about sleep apnea all the time in our show as it relates to snoring. And what you're talking about today is people who are chronic snorers.
Right.
And it's not sleep apnea.
Not necessarily. I mean, this can work for real mild cases of sleep apnea, but the real goal of this is for folks who snore. You know, and that's actually most folks. I mean, everybody hears about sleep apnea these days, and you're kind of, tuned into that, and sort of everybody steered that way. But most people who snore don't have sleep apnea. Most people who snore, so I mean, it's a serious problem. And if you have it, we need to address it. But those folks that don't have sleep apnea and still snore and are keeping their bed partners up at night, that's miserable.
And that's
the problem. It's a nuisance. I mean, it's a nuisance. It's no good for anybody. If you snore and you don't have sleep apnea, you're sleeping. So you kind of get off the, you're kind of out of it until the next morning when you hear about it, basically.
Well, and how much do you think on average that the bed partner loses sleep due to this?
It depends. I mean, part of this equation is the snorer and then how light the sleeper is next to you. And you can get some pretty bad combos, but I mean, you can lose an entire night's sleep, and it adds up. And so a lot of times it's the person next to you that's getting hit the most, and it's every night, night after night, until you get kicked out of the couch or the guest room or wherever where you're not around.
How many people do you think there are out there who have a chronic snoring problem?
It's about a quarter of the U.S. population, so 1 out of every 4 people, and then it's usually the other fourth, basically, that's dealing with that first fourth. So, half the population is affected. The United States population is affected by this, and most people aren't doing anything about it or don't know that there's anything they can do.
But there is a solution. There's something you can do to end this forever. And it's called what? The pillar approach.
Called the pillar procedure. And it's just that. And what we're doing with this procedure is we're putting little implants into the palate. So it's an area that just above the uvula, the little punching bag back there. We put them in underneath the surface, and we used to use just 3, but now we're using more than that. And what happens is your body creates a reaction to that, to the implants, and stiffens that area up.
They're really small, aren't they?
I brought one.
Okay, it's about the size of a, I don't know what to...
like the little part of your shoelace that's sort of hard, that's about the same size. It's about a little over a centimeter, but it's not that hard. I mean,
and it's implanted underneath the skin in the back of the throat.
Yep,
and
exactly.
You put in how many of them?
We used to do 3. Now we're doing more like 4 in a female and 5 in a male. And we actually have found, and it's been proven, that the more the better. We weren't sure. It's been around for about 5 years now, but now we've got a lot more understanding of how it works. It worked well with 3. It works a lot better when we put more in, if somebody's got the space to fit them.
So you can't feel it.
Correct.
But how does it work?
So we put them in under the surface. There's a real thin band of muscle back there. That's where it goes in. And then what ends up happening is your body reacts to it and stiffens the tissue up. So once they're in, the process is simple. Somebody comes to the office. We do it just under local anesthesia. You walk in, you walk out, that sort of stuff. You're able to eat and drink whatever you want that same day. Once it really takes hold, it usually takes a few weeks to really take hold. It stiffens things up, and then it's a permanent fix. It's not something that you have to use every night, not like a machine or not like a dental appliance, which is nice. I mean, a lot of people, have the issue. They don't really want to go there as far as the sleep apnea side of things goes. And really, if they aren't likely to have sleep apnea and they've got the right anatomy, this is a great solution for them. And it's quick, it's a quick fix and a one-time fix, and it's not something that you have to be kind of thinking about or messing around with every night. All that sort of stuff gets to be a nuisance. So
is it covered by insurance?
It's not. So, flipping around everything we just talked about as far as the sleep apnea and how serious that is, this is really a cosmetic issue. Snoring is typically. So insurance companies will look at this and say, they don't want to do anything to do with it. And so, that's another reason why a lot of folks don't do anything about it. But it's, again, it's the upside, even though the insurance isn't covering it, is that it's a one-shot deal, and it tends to be very, very effective for most people who snore.
Yeah. So what's something that you guys can do to help people reduce the cost if this is something that's important to them?
Well, really the thing that we've done, or one of the things we've done, is basically do what I said before, upping the implant. So it used to be 3, and there was a flat fee for that, and now what we do is it's just a flat fee. It doesn't matter how many implants we put in there. You know, I'm going to try to fit in, like I said, as many as I can possibly fit in that's reasonable, and you know, and it's still the same price, and so that does tend to help, and so we'll be able to be as effective as possible, as efficient as possible, and try to put an end to this for once and for all.
And for a lot of people out there who are losing sleep because of a chronic snorer in the bed, they're thinking, my insurance should be covering this because my loss of sleep is a serious issue. Here's the information for advanced ear, nose, and throat specialists to inquire about the pillar procedure if you have a chronic snorer in your bed or if you chronically snore. The phone number is 414-771-6780, located on North Mayfair Road, and the web address is advent.md. Always nice to have you.
Thank you so much.
Thank you very much.
And let's take a look now at our art.